Well, thank you for joining us on TVC News at 10. Nigeria's Minister of Health has assured that Kano State is currently getting an accelerated response to the outbreak of the coronavirus in the state. Also, health authorities say they now plan to test 2 million Nigerians in 3 months. TVC News senior correspondent Femi Akonde reports.
Virtual task force.
The DG of the Center for Disease Control, Chikwe Ihekweazu, says more financial and material resources will be required to quickly flatten the curve of transmission. He says the cost of carrying out one COVID-19 test is about $18. He also recently disclosed that more than 11,000 tests have been conducted across the country. That means about 80 million naira have been spent on testing alone in Nigeria, and even more spent on procuring medical facilities and personal protective equipment. Despite all of these, the coordination of the government's response plan remains a priority for the presidential task force, especially the situation in Kano, which continues to draw so much attention.
In order to test 2 million people in 3 months across the country, we need to test about 50,000 per state, plus minus depending on your population size. There's no other way we can do this. We need the cooperation and collaboration of every state government in Nigeria, every department of public health, and we need the collaboration of the people living in these states. The only entry point into control of this outbreak is through testing.
As the next phase of the lockdown begins, with a projected plan for a phased and gradual easing of lockdown measures, the Secretary to the Government of the Federation says it is also time to take a greater personal responsibility to slow down the spread of the virus.
This is a time for each and every one of us to take personal responsibility. And the only way we can take personal responsibility is to take heed of the adversaries. The medical adversaries of keeping social distancing, of personal hygiene, of wearing masks, of avoiding unnecessary travels and unnecessary visitations.
The glimmer of hope in the dark cycle of the coronavirus is the expansion of testing capacity in Nigeria.